Okay. Thank you very much. First of all, I would like to personally thank Professor Bossing for inviting me here. It is a great honor for me. As I reflect a little bit about my journey in the topic of spirituality, when I was a PhD student, I have wrote a lot of research from the keynote speakers of this conference. So to be here today presenting, it's a great honor for me. Another disclosure is I have to apologize about my English. It's not so good. So you have to be a little bit patient. And that's why sometimes I have a lot of text on my presentation. So the topic of my presentation is about the validation of Owen gratitude scale and nature connectedness scale. And the relation with psychological variables in Greek population. There are two independent studies, yet together combined, they contribute to the general insights and understanding on how spirituality and nature can contribute to improve well-being. It is a fact that over the last decades has been an increasing interest on the relationship between spirituality, emotional well-being, and the contact with nature. Research have demonstrated that these factors are improved psychological well-being, stress reduction, resilience, enhanced quality of life, and greater emotional balance. On the other hand, modern societies and cities are characterized by urbanization, technological overload, social isolation, environmental crisis, which intensely needs the need to reconnect with both spirituality and natural world. Awe and gratitude are increasingly recognized as important experiential dimensions of spirituality. Awe refers to the moments of wonder, admiration, transcendence, emotional openness when individuals encounter beauty, vastness, or meaningful experience. Gratitude reflects the appreciation of life, existence, relationships, and meaningful experience. The Oregon Gratitude Scale was developed by Professor Bushing that measures these emotional and experiential aspects of spirituality. Importantly, the scale includes reactions to nature, silence, contemplation, moments of emotional transcendence. In the same context, the nature is not simply a physical environment. For many individuals, nature represents emotional restoration, psychological relief, existential reflection, and spiritual connectedness. Traditional instruments assessing nature connectedness mainly emphasize to cognitive or identity-based dimensions. However, often those measures fail to capture the experiential and emotional aspects of interaction with nature. The experience of nature scale was developed to address this gap. Nature, nature exposure and meaningful environmental experience promote positive and emotional and cognitive responses. O elicits the nature, enhance the transcendence, humility, wonder, and sense of interconnectedness. Nature-related gratitude strengthens the appreciation, the positive effect, mindfulness, and meaning in life. Moreover, connectedness to nature fosters belonging, emotional closeness to natural world, and environmental responsibility. Awe and gratitude deepen the nature connectedness, with them enhances psychological well-being. The psychosocial benefits include reduce stress and anxiety, improve resilience, life satisfaction, social connectedness, and psychological flourishing. So the aim of the presentation is to present two interconnected studies of validation conducted in Greece. The first one was including the instrument of Owen graduate scale in patients with chronic diseases and conducted in 2022. And the second one is the translation, cultural adaptation, psychometric validation of experience nature scale in a sample of Greek population. Together, these studies contribute to the assessment of experiential spirituality, emotional engagement with nature within the Greek cultural context. So I will begin with the first study, the study that conducted among chronic patients in 2022, in which study it was also validated the Owen Graduate Scale, and it investigates the psychometric properties, examines the relationship with mental health, spirituality, and quality of life among patients suffering from chronic diseases. This study was conducted in my hometown, in Larissa region in Greece. It took place from June to August of 2022, as I mentioned. 210 patients with chronic diseases participated in this study, and the sample was recruited from outpatient facilities based in Larissa. So inclusion criteria for those, for the population was to be aged 18 years and older, to have the ability to speak and understand and write in Greek, and have a chronic condition. This study was, and the second one was approved from Ethical Committee of University of Thessaly. So the instruments that we use the ON graduate scale, to, the 7-item ON graduate scale, along with a questionnaire to assess anxiety, depression, quality of life, the 5-item well-being index, the Acedia symptom scale, the Franciscan spirituality questionnaire, and the spiritual dryness scale. So, regarding the translation procedures, the Greek adaptation followed the national guidelines to how to translate and culturally adapt instruments. That included the forward and backward translation, the expert panel evaluation, the cognitive assessment from chronic patients, and furthermore, confirmatory factor analysis and reliability analysis were performed using SPSS software and SAS software. As I mentioned, 220 patients participated. The mean age was 63 years old. The majority, the 50.4% were male. Most of the participants lived in urban areas. The majority were married, and more than half, the primary diagnosis was type 2 diabetes. The sample also included patients with cancer, neurological disorders, and chronic pain conditions. The results of confirmatory factor analysis show sometimes poor or marginal fit indicates, but yet it could be considered acceptable, and the study was published in a scientific journal. The test-retest reliability demonstrated strong stability over time. Internal consistency was satisfactory, comparable to the original development validation study, and this findings supporting the reliability of the scale for the Greek population. Moreover, we conducted some further analysis to see the convergent and discriminate validity. So it was found that the ON graduate scale was associated, positive associated with the mental component of quality of life, a negative associated with depression and anxiety, and it was also positive association with living from faith scale. So one important finding of this study is that during the multivariable regression analysis, O and gratitude stayed inside the model, so it contributes to improved, according to this analysis, to improve mental component of quality of life, and also helps to decrease depression and anxiety. So the findings of this study suggest that ON gratitude may function as psychological and spiritual resources. Experience of admiration, silence, wonder, and gratitude appear to strengthen emotional resilience and support psychological adaptation to chronic illness. And the results also reinforce the theoretical perspective, suggesting that spirituality is not only a religious practice, but also emotional openness to meaning, beauty, and transcendence. Importantly, the Greek version of the scale has successfully captured these experiential dimensions in Greek population. Moving forward to the second study about the experience of nature scale, similarly here in this study that was conducted in 2024, we translate and adapt the experience of nature scale in Greek population, and again we examined the relation with psychological variables. So in this study, 281 persons, adults, recruited, mainly from social media platforms. Before forward and backward translation according to international guidelines was conducted. And again, confirmatory factor analysis in Cronbach alpha for intended consistency, examining the psychometric properties of the scale. The experience of nature scale, it is a scale of 11 items, beginning with the phrase, when I'm in nature. And the scale evaluates 3 dimensions, as it was mentioned before in the previous presentation: detachment and relaxation, fascination, admiration of nature, and sense of responsibility towards the environment. And it is a 5-point Likert scale. So the sample was mainly considered by women in 84%. The mean age was 35 years. The majority had a higher education degree, living in urban environment, and had no health problems. So in this study, the confirmatory factor analysis supported the original 3-factor structure, and the model demonstrated excellent fit with the indices exhibiting supporting that. Also, the internal consistency and reliability of the scale was excellent across all the subscales. And item to total correlation range from 0.7 to 0.8. Then this result demonstrates strong homogeneity and reliability. Participants reported high scores in the subscales for admiration of nature, the sense of responsibility. Higher was those scores, and these findings suggest that the Greek participants perceive nature as a source of psychological restoration, emotional fascination, and ethical engagement. Nature experience is not merely aesthetic, but also morally and emotionally. So, moving forward to the relation of nature, we have observed some positive relations, negative relation with depression and anxiety, but an interesting finding and quite surprising, it was that it was positive related with aggression. And it is something that it's worth to reflect on that, and maybe conduct more and larger scale studies to try to understand why did this happen, why we have this finding. And also it has a positive effect again in mental component of quality of life. So the Greek version of experience of nature scale demonstrates significant association with psychological variables, such as the everyday detachment relaxation was negative correlated with depression and anxiety. The fascination of nature was also negatively associated with depression and anxiety, and the sense of responsibility towards nature showed a weak but yet significant negative correlation with anxiety. And all these 3 dimensions were positive associated with the mental health component of quality of life. Findings support the restorative and emotional protective role of nature. As some takeaway messages is to remember that the experience of nature scale was associated with, seems to decrease, the experience of nature seems to decrease the depression and anxiety and improve quality of life, the mental health quality of life. Yet we have to wonder why there is this relation with aggression. And maybe because individuals that are intense may find in nature a way to cope with this aggression. And regarding the other study, that we have to remember that the OM graduates have a strong association with psychological variables and the mental health quality of life. So these instruments are very important in the Greek setting, cultural setting, because it can have many applications in healthcare research, mental health care, psychological, psychosocial interventions, health promotion, environmental education, and community health programs. There are some limitations of these studies, the convenience sublinks, the cross-sectional design, and over-representation of women in the second study, and the limited geographic representation because it was the studies was conducted mainly in Larissa region. So maybe future studies should include longitudinal designs, more diverse population, adolescents and older adults, clinical populations, and cross-cultural comparisons. To conclude, the Greek versions of all graduate scale and experience of nature scale are demonstrated satisfactory to excellent psychometric properties. Both instruments appear to be valid and reliable and culturally appropriate for the Greek population. These studies reinforce the importance of emotional, experiential, and spiritual dimension of health and well-being in research. So they also highlight the therapeutic and existential significance of awe and gratitude and human interaction with nature. Just a quick notice that I have the honor to serve as a guest editor in a special issue of Primary Hospital Care Journal in the topic of spirituality and mental health in chronic care. So you feel to check it out if you would like to submit. And to invite you next year in 2027 in my hometown in Larissa, where the 12th International Conference of the EPIC Network will take place. The EPIC Network is a network that aims to enhance nurses and midwives' skills and competencies towards to spiritual care. So this is a map of Greece, my hometown, the Mount Olympus and Meteora that are close by. Thank you very much for your attention.